New research from the Department of Homeland Security believing that heat, sunlight, and humidity may have a powerful impact on killing COVID-19.
If you look at the coronavirus as a chain with many links, what we've done through our study is we've identified some of the weak links in that chain that the transmission of the virus depends upon. We identified that heat and humidity is a weakness in that chain. We've identified that sunlight, solar light, UV rays is a weakness in that chain. The virus dies the quickest in the presence of direct sunlight.
So, what does this mean as we approach warmer weather? I want to bring in now our panel to discuss it. Joining me now is epidemiologist and professor at Mercy College, Dr. Rassi Assad, and CEO of Remote Healthcare Solutions, Adam Hardage. Good to see you both here on this Friday. Doctor, I'm going to start with you. What do you gather now from that information we just played?
Regarding UV rays, I think it has long been established that UV rays can serve as an effective disinfectant, but for external surfaces. In fact, there's long established phototherapy for treating certain mild skin conditions and also for treating mental health conditions, not to mention babies who have jaundice. But using UV rays in an invasive or internal way for systemic infection has not been established.
For what we know right now, social distancing also still playing a big role. That's the biggest weapon we have right now. Adam, using telehealth, not bringing people into the emergency rooms through your service there is helping out with that.
Yes, absolutely. In fact, for us, the name of the game is isolation and containment. So while I believe in the old adage that sunlight is the best disinfectant, I believe my grandfather taught me that one. And then as well as further reinforced with my time in the military when we would frankly use the sunlight to solve a whole host of our problems in the field. And we all know about UV light being effective. And I will say the best aspect is if we can utilize technology to keep people from getting infected in the first place. And that's what we try and bring to the fight.
I want to play this or rather tell you about this. The results from New York's first coronavirus antibody study showing nearly 14% tested positive, doctor, meaning they have had the virus at some point. Governor Cuomo of New York saying that equates to 2.7 million infections statewide. If this is true, more than 10 times the state's confirmed cases. Doctor, what do you make of these numbers? That would mean 2.7 million New Yorkers, almost 3 million New Yorkers could have been infected with COVID-19. Any truth to this study?
Well, from the trajectory that we have been observing, we expected to see or to find out that there's a high level of infection in the community. However, with 14% being infected across the state, and I would argue that that number is probably a bit of an overestimation, given the methodology used for this seroprevalence survey. It's not the typical sound methodology, especially the type of sampling used. And I think the governor cautioned us against thinking that it's the sound or typical methodology. However, even if you assume that 14% of the population here in the state is protected by way of having antibodies, you still have the overwhelming majority who remain susceptible to infection, and that is, in excess of 80%.
I have an epidemiologist here, Dr. Assad, so I want to ask you another question about contact tracing. For any American, you hear contact tracing, it could seem sort of an invasive procedure, if you will, someone kind of monitoring where you're going, who you're talking to, et cetera. But is contact tracing a commonplace in your study, sir?
Contact tracing is old-fashioned epidemiology. It is how we control the spread of any disease. And contact tracing simply means identifying those persons who have been exposed to an infected person and getting them tested or any help that they may need.
Yeah, I'm glad you said that because to try to help and ease the fears, I think this is something we're going to see happen here. Adam, really quick with you too as well. There may be some fear about getting on the phone and kind of, doing your whole doctor appointment on the phone or a laptop or anything like that. That could be new. How do you quell those fears?
Well, I think it's an educational process. It takes time. And, frankly, a month or so ago, it was or maybe 2 months ago, it was a sleepy little industry, telemedicine. And then the president, thankfully, with his new policies and the laws that Congress have enacted and the president has signed, has really shot our industry out of a cannon and I would say into the stratosphere. And from here on, I don't think we ever go back. I think telemedicine is absolutely the way of the future. And I think even while some people are slow to embrace it, the benefits are just so clearly evident at this point, especially in this fight, that I don't see it going back the other way.
There's so much evolution happening right before our very eyes. Dr. Razi Assad, epidemiologist and professor at Mercy College. Adam Hardage, CEO of Remote Healthcare Solutions. Thank you both. Stay safe, guys. Have a good weekend.
All right, still to come, we're going to hear from one pastor on